Hello and welcome. A Sero survey conducted by the BMC, that's Mumbai Civic Authorities, on about 7,000 people in 3 of the city's civic wards, found that 57% of the people tested in slum pockets had antibodies to COVID-19 as against 16% in non-slum pockets. Now, the SARS-CoV-2 seroprevalence study was done by the BMC along with the Tata Institute of Fundamental Research, Niti Aayog, and the IDFC Institute, and covered North and Central Mumbai. Now, the questions are, what did this survey show up that is different or more insightful than before, apart from the data? And what more can we understand from this data, which will help us potentially in understanding the transmission of the disease and also what our response will be, including at a civic level? To discuss this, I'm joined by 3 of the people who worked on this survey: Dr. Daksha Shah, Deputy Executive Health Officer at the BMC; Dr. Ullas Kolthur, Professor, Department of Biological Sciences at the TIFR; and Dr. Jayanthi Shastri, Professor and Head Microbiology at Nair Hospital, and also Head of Molecular Diagnostic Lab at Kasturba Hospital. Thank you all for joining me. Dr. Shah, can you tell me broadly how you defined this study, the scope of this study, and how you went about it?
So I think the study was planned in the month of May and early June. And it was decided, when we had the early meeting with the partners, that we will take wards which is representing the 24 wards of Mumbai, and one is from the city, one is from the eastern and the western suburb, and also those which was reporting the highest number of cases, the moderate and the lowest number of cases. So and also it has planned that we will have not only the slum populations, but we will also cover the non-slum representation. So this is how the basic idea was, that we should have maximum representation from the population which we are selecting, and also again the age and sex wise stratification was done. So the study was planned basically to understand what is the extent of spread of infection, and going further, whether it is going ahead or whether it is reducing or whether it is static. So this survey was planned basically to understand the spread of infections and the level of antibodies which might have developed into the population.
Right. Dr. Ullas, can I come to you? So can you define the project and the scope from your perspective?
We want to capture whether population density, crowding, and socioeconomic conditions would be factors that could drive prevalence. And this could be true not just in Mumbai, but many other complex metropolis which have, city populations are not homogeneous, right? So it's important to address what factors could be contributing to this. And in fact, if you don't have data, you can't form hypothesis. So we wanted to do this study to get this kind of cross-sectional information in these 3 wards. And Daksha rightly pointed out that we wanted to do this in 3 wards which had high, low, and median reported cases. Therefore, it would be in some sense representative of many wards.
This actually indicates, that there are some asymptomatic infections which is already there in the community, and this has given rise to the antibody response, which is in a way it is good. We have now understanding that there is quite sort of protection which is there in the community, and especially in the slum areas. However, we need to look for whether this is going to be static or whether it is going to reduce or increase. And also it is important, since right now what we are observing is the more cases coming from the non-slum areas. And I mean, today also, if there are cases which is reported, we have more cases reported from the non-slum areas compared to slums. So these also kind of collaborates, this finding with our studies. So definitely there is a level of, immunity which is getting reached. But to what extent it will go to the herd immunity, I think it is yet to known. So definitely there are a lot of expert opinion required on this.
Right. So does this mean, speaking as a medical professional, so does this mean that these people, or this 57% representative sample, have actually got this disease, or they have not contracted it, or are they just immune to it?
So I would say that they've got exposure to the virus, and they have to respond. Bodies have produced the antibodies. Now, some of them might have suffered a very, very mild, or they might have remained asymptomatic. But the essence is that they have got infected and they are asymptomatics, or few might have been a very mild asymptomatics. So this is what we can think of.
And to what extent are we sure that this sample was exposed to this very virus, which is COVID-19?
I think regarding the technology of the study, Dr.
Let me answer this question, Daksha.
Go ahead.
Yeah. So basically, let me tell you that in the private sector, what tests are they are accessible to the best quality tests in private labs. So what we ensured through this survey, that we would use the best quality test when it comes to, screening for the presence of the antibodies. So the test which we have used is the Abbott chemiluminescence test, which is 100% specific. So that answers your question that there is no cross-reactivity with other coronavirus infections as well as with other respiratory viruses. So we are very sure that all the samples which are positive are true positives, and thereby we would like to believe that the prevalence which we have seen across the slums and slums, which is 57% and 16%, these are the people who have the antibodies, and that means they have been exposed to the infection. They could have been asymptomatic.
Right. So there was as I understand it, Indian Council of Medical Research survey in May, which talked about a 30 to 40% seropositivity in Mumbai slums. So that figure is increased. So are we able to project in any way how this the transition or the trajectory of the virus is moving?
So maybe I'll say this. So our study specifically excluded containment zones, which were active during the period of the study. And in fact, reflects, is more representative in terms of population which has either been asymptomatic or mildly symptomatic and recovered, right? To get a true prevalence and the change, in fact, we're going to do a second round because we want to go back to the same populations and in the same stratified manner because we want to get high confidence, statistically, low variance data. And we're going to do this in the month of August. And that's when we'll actually see whether in the slums and in the non-slums, because they're showing two different numbers. It will be really exciting to see which of these show and what, to what degree will you see a change. That will have a huge impact on our analysis and others who can think about herd immunity and all of that. So it will be useful data.
Right, Dr. Shah, are you able to extrapolate to the total population of slums by using this, saying that for instance, let's say if Mumbai has a population of 18 to 20 million, maybe 40 to 50% are in slums, and therefore 47% or 50% of that figure are likely. I mean, no one is saying this definitively, are likely now immune to this disease.
Yeah, I would say not immune, but I would say that they have been exposed to the infection, and similar wards which has a similar population pattern and the demography could be the similar type of antibody response be available, and that is why we will also plan something in for the many wards. And I would say this study of extrapolating into other wards and the modeling is underway. So we will definitely look into how it can be projected for the entire Mumbai.
How would you look at this data versus the fatality rate that we've seen so far in the city of Mumbai?
Yeah, so the thing is, the idea of this study was not to necessarily get just a representative, a number which could be reflective of the entire city. There are benefits of doing that. There are also benefits of actually understanding, like I mentioned earlier, what are the differences, and because this is useful to know if you want to bring in a policy change, would you want to apply it globally across the entire city, or do you want to tailor it based on slum and non-slum? There, I would say that probably BMC's approach to handle this both in the slum and the non-slum differently has paid off to some extent, right? So what we're seeing as lower infection fatality rate and all of that could be because BMC is actively isolating symptomatic people and getting them medical treatment. So that I think seems to be working. So the idea is there are two approaches. One, you can get a number for all the wards, a number for the city that has its value, but studies like this which have more cross-sectional information also have value, because then you can go back and ask what kind of parameters will be actually influencing the prevalence.
Right. Dr. Shah, last set of questions to all of you. Dr. Shah, let me begin with you. So having got this information or data, which obviously people are relieved to see, what are the next steps, or at least what are the likely next steps going forward for the city?
So I would really say that this should not lower our guard. We are going to continue our preventive measures and our efforts in containing the spread of the virus with the same vigorous and the vitality. I would say that we should continue to do this. The people should not take this as some kind of a green signal. I would say that there are still some susceptible population which is there who can get infection. So wearing the mask, social distancing would be very important measures which people have to keep in mind. And with the precautions and with all the necessary, I would say the safety measures, the people can do their necessary work as usual now. And the fear and this stigma which is there, I think we need to tackle those, and we have to focus basically on our mortality rates. We have to focus basically on our high risk individuals and the populations, how we can protect them, the most vulnerable. That would be, I think, in the coming days, we should be focusing on.
Right. And yes, absolutely. And the most important thing, this is not a green signal to go out and party. Okay, Dr. Shastri, how are you taking this data, and how are you looking at things ahead? What are the new research angles that you would be possibly examining?
I'm actually I'm looking forward to the second round, because we would like to see how the prevalence varies between the first and the second round. And talking of immunity, there is a lot of data which is coming around the antibodies, whether they last, whether they confer protection. So basically, it's only time will tell us. And as part of this study, we are also going to look for the neutralizing antibodies in these samples. That would also give us some clue about the level of immunity and how much antibodies are required to confer protection. So yes, it's a very well planned study, and we look forward to the second round also.
Right. One quick question here. Do any of these sample people who are part of the sample include those who have recovered from the disease, like formally recovered?
Could have been.
Could have been.
Could have been, because this is anonymous. I mean, it could have been.
Okay, got it. Okay.
So we did not capture that information in the survey form.
Right. Okay. So, Dr. Ullas, so now we've also seen a similar survey in Delhi, and are you looking at data from other places or centers in the world, and how is this converging, or any other insights that you can draw?
Right. So this is very useful, because what we think is prevalence today is going to be continuously changing, in a week's time, right? So I think this will provide a lot of information for people to compare both longitudinal studies and cross-sectional studies to understand exactly, how does the disease spread, what are the manifestations, susceptibility of populations, and most importantly, this holy grail of, if and when there will be herd immunity, right? But remember, this all depends on how long the immunity lasts. New data is emerging, and I think that's going to be really exciting to look forward to these things.
Right. Dr. Shastri, Dr. Shah, and Dr. Ullas, thank you very much for joining me. And I do wish you and your teams all the very best as we continue this struggle and fight against COVID-19. Thank you very much.